Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 weekly pandemic update with data accurate through December 30th, 2021. As this will be the last update for the year, I wish you all a very happy new year, and I certainly hope that 2022 is your best year yet. This week, I'm going to cover three things: what's happening to the current surge, as I've been talking about for the last few weeks, and then also talk about what the CDC has recently said about the quarantine and isolation changes and why they are controversial. And then I'll answer a question that came in from a viewer about new guidance on masks. So what's happening with the current surge? We're continuing to see the same trend of a record number of cases, more reported cases globally than we have seen. But in terms of deaths, the death rate has not been going up. And that's not to say the death rate is acceptable. We've had almost 5.5 million deaths, and we're still running about 6,000 deaths a day globally. But we're not seeing the same pattern with deaths that we're seeing with cases. And the same is true in the United States. We're actually reporting the greatest number of cases per week that we've had since the pandemic began. But again, the death rate seems to be level. Almost 850,000 deaths to date, and we're running about 1,000 deaths a day in the United States. And we're seeing hospitalizations appear to be slowing down as well, though we're not absolutely sure of that. So it raises an interesting question, which is why should we be seeing a record number of cases, but either a lowering or a stable death rate, both globally and in the United States? And there's a number of possible explanations. One, we're just simply doing more testing. If you do more testing, you'll find more cases, but they're not significant, they're not symptomatic. Obviously, quality healthcare, earlier or better care, improved hospital and home treatments, and a better understanding on the part of doctors about how to treat that could certainly make a difference. There's at least a theoretical possibility that people are getting a lower exposure dose from wearing masks, or a longer delay between exposure and serious illness. In other words, we will start seeing more deaths in time. And then there's the possibility that more people are vaccinated and therefore reducing serious illness. And of course, there's the possibility that the variants may be less lethal than previous ones. I tend not to think that those two are relevant. Obviously, more widespread testing certainly will produce more cases. And I also think that the last two are relevant. So I think what we're seeing is more testing and we're identifying cases. The fact that more people are vaccinated means less serious illness. And probably the current variant is less lethal than previous ones. That's the Omicron variant. In terms of Tennessee, what we're seeing is an increasing number of cases, though not quite to the same level we've seen nationally and internationally. And again, we're not seeing a significant increase in deaths, though again, we've had over 20,000 deaths in our state and 50 to 60 deaths every day. So it's still a very significant problem for us. In terms of hospitalizations, the last couple of weeks, we have seen this increase in hospitalizations in Tennessee, which is a bit worrisome. A week ago, this is where cases were happening in the United States. You can see it was sort of in the north and northeast, but this week it's changed a little bit. And if you look at it, what we're seeing now is increasing cases in our southeast urban areas: Nashville and Memphis, Atlanta, Birmingham and Montgomery, Jackson, Mississippi, New Orleans, Baton Rouge, Shreveport, and then in the Miami area. So in a single week, we're starting to see a changing in the pandemic. And unfortunately, this is the pattern we saw before. You'll remember that we actually saw it sort of explode in the southeast and then move up into the upper Midwest to the Dakotas and so on. Hopefully, we're not going to see that again, but this is the pattern that we're starting to see now. In terms of our region, 254 people are hospitalized in Ballad Health. And again, this seems to be creeping back up. We don't know if it's going to level off or keep going up. But as we've said many, many times, overwhelmingly, these are folks who are not fully vaccinated. 91% of the hospitalized patients are not fully vaccinated. 92% of the patients in the intensive care unit are not fully vaccinated. 95% of patients that are intubated are not fully vaccinated. Clearly, time and time again, we see that full vaccination now with booster is a great predictor, a great protector against serious illness. So the surge is a surge in cases, not yet a huge surge in deaths, but we're still in the midst of a very serious global pandemic. And then this week, the CDC changed their rules about quarantine and isolation. Isolation, of course, is for folks who are infected. And they're now saying you can isolate for 5 days if you have no symptoms or if your symptoms are resolving and no fever for 24 hours, followed by 5 days of wearing masks. And the logic, according to the CDC, is the change is motivated by science demonstrating the majority of SARS-CoV transmission occurs early in the course in the 1 to 2 days prior to symptoms and the 2 to 3 days after. In terms of quarantine, if you've been exposed, for people who are unvaccinated or more than 6 months out and not yet boosted, they recommend quarantine for 5 days, followed by strict mask use for another 5 days. Then they say, alternatively, if 5 days is not feasible, then the exposed person should wear a well-fitting mask at all times for 10 days. People who've been boosted, vaccinated and boosted do not need to quarantine, but should mask for 10 days after exposure. And then, if at all possible, a test at the end of 5 days. And obviously, if anyone develops symptoms, then the whole thing goes back and you have to isolate until you've had a negative test. So why is this controversial? Well, it's controversial for several reasons. One is it's unclear why the changes were made now when we're clearly seeing a spike in cases. We're in the midst of a holiday season where increased exposure is quite likely. There is a new, less known variant occurring, and most of the data that we're basing these decisions on was pre-Omicron. And then there are some parts of the country, particularly in the Northeast, where the health systems are already overburdened. So the question that some have asked is, why is the CDC making this decision now? And unfortunately, there's a perception that this may be made more because folks yearn to return to normal rather than that these recommendations are the best for health. And this was not helped by the quote from the CDC director who said it has a lot to do with what we thought people would be willing to tolerate. I'm not saying this decision was wrong, but this is why it was controversial. It's also controversial because there appears to be another more logical approach, which would be you could take all of these same recommendations and then say, at the end of this, you need to have a rapid test, a negative rapid test before ending isolation. That on top of the 5 days would probably be very reasonable in many people's minds. Just to remind folks of what this is like. So say there's time zero when you're exposed to SARS-CoV-2. Initially, there's an increase in your viral load, then it shoots up. And it's sometime around then that you're going to get symptoms if you are, when the viral load is high. And then over some period of time, it drops down and you have clinical improvement. According to the CDC, you're usually infectious 1 to 2 days prior to symptoms and 2 to 3 days afterwards. And so in that case, a 5-day quarantine isolation seems to make sense, right? It takes you out past the time that you're infectious. But there's a couple of scenarios in which that may not be true. One is if you test positive very early in your clinical course, or if you have a clinical course that's going to take a longer period of time. So what many folks are suggesting is that maybe this 5 days could have been added to by having a negative rapid test. I'm not saying the CDC guidelines were wrong. It's just that this is the source of the controversy that you'll see in the headlines. And also controversy now going on about masks. There's a lot of headlines coming out of experts saying we should not wear cloth masks, that we should upgrade our masks because of Omicron. I went to the CDC website. There is no clear update on their recommendations. They still say folks 2 years old or who are not fully vaccinated should wear masks in indoor public places. And in general, you don't need to wear masks outdoors unless you're in close contact with folks who are not vaccinated. Of course, this is, guidelines are different for folks who are immune suppressed, either because of age or because of medication that they're taking. And they always suggest that everyone wear masks indoors if you're in risk of an area of substantial or high transmission. They recommend that you choose a mask that has 2 or more layers of washable, breathable fabric, completely covering your nose or mouth. It fits snugly. It doesn't have gaps, and it has a nose wire that can pinch it across the nose. They suggest that you do not use masks that are hard, make it hard to breathe, that have exhalation valves. And this is where it gets controversial, because what the media is saying in their headlines is that you should wear an N95 mask. The CDC is saying you should not, because those should be prioritized for healthcare personnel. And of course, the CDC continues to identify ways in which masks are not effective if they're not worn. Just to remind you that there are different guidelines for healthcare professionals in certain workplaces. But in general, as far as I can tell, the guidelines have not changed. So the surge we're seeing is a record number of cases, a stable number of deaths. The CDC has updated their quarantine and isolation guidelines, so some have suggested they would be better if they included return to normal after a negative test. And there's no new guidance on masks, but there is media attention to it. And so I would suspect in the next couple of weeks, we may see some updated guidelines from the CDC. There's a great deal more information about COVID-19 on the College of Public Health website. As always, if you know anyone who you share these videos with or who might like to receive them, please let us know. We will send them to them. As always, I'd like to thank Dara Young for editing, producing, and posting these videos. If you have any questions about these videos, what I've said today, or any question about COVID-19, please let me know. Often I base my weekly updates on the questions that I've gotten from you all. Until next week, until 2022, please be well. I hope you do have a happy and wonderful and safe New Year. Thank you.